Colorado seniors rallying together. They say any changes to health care laws could impact their lives. Also, next year's Colorado election is expected to be one of the most secure ever. We're going to find out about the changes that are in store. I'm Ann Trujillo, and welcome to Politics Unplugged. President Trump still hoping to repeal and replace Obamacare. The president hosted a lunch for Senate Republicans last week, but conservatives and moderates in the party are pushing in opposite directions. And in a last-ditch effort, Senate Majority Leader Mitch McConnell is planning a vote this week that would repeal Obamacare without any immediate plan to replace it. The Congressional Budget Office says repealing Obamacare without a replacement could leave 32 million people without insurance by the year 2026.
The Obamacare repeal legislation will ensure a stable, 2-year transition period, which will allow us to wipe the slate clean and start over with real patient-centered health care reform.
Now, the repeal bill may not even happen at all. 3 Republican senators have already come out saying they will block any repeal measure from getting a vote on the Senate floor. Now, we have invited 3 women with unique perspectives on health care to talk about what this could mean to people living here in Colorado. We've invited State Senator Irene Aguilar, Andalee Klein, and Pat Narup from the Kavod Senior Living Center here in Denver. So thank you to all 3 of you for being here to discuss this very important issue. And Senator, I want to start with you. I know you're a physician. You also have a child with developmental disabilities.
That's right.
You see what's happening in Washington. What are you thinking?
I'm really concerned about what Washington's plans are for Medicaid in particular. Medicaid is our safety net. I think most people don't realize that over half of nursing home costs are paid for by Medicaid. In addition, while the state is required to pay for nursing homes, our state has a waiver that allows us to pay for home and community-based services. And these waivers allow many people with disabilities and seniors to continue to live in their homes and not have to be in nursing homes. Now, the threat under the Republican health care plans has been that they would change Medicaid to a per capita cap. And basically what that means is that instead of covering whatever it costs us to provide quality services to our seniors and disabled in their homes, they would cut us off at a certain point, which would likely mean that we would be forced to cut these more optional programs like home and community-based services. And that's why this is so important for our seniors.
And how does this affect you or other parents who have children, for example, with developmental disabilities?
Yes, actually, as our children age, we worry about what will happen to them as we age as well, and who will be their safety net. And right now, that safety net is Medicaid. And so I would have concerns about how my daughter's home care would be paid for, whether she would be forced into an institution because the state could not afford to allow her to live at home, and all the concerns that come with that. You know, we hear so many stories about inadequate staffing and really not being able to have a quality life anymore.
Mm-hmm. All right, Pat and Andalee, I know you two organized a rally outside your the Kavod Center on Wednesday because I know residents there are very concerned. So what was that all about? Explain that.
Actually, it was not a political rally at all, because if you are living in subsidized housing, it doesn't matter whether you are a Republican or a Democrat.
Sure.
You're bound to have your Medicaid and Medicare cut. None of us can afford to do that because we are at the stage in our life where our medicine is more expensive.
Certainly, our residents there of over 400 people, it gets very hard for us on limited income. And when we hear the news coming from Washington about increase in your insurance cost, the decreases in Medicare and Medicaid, it's very scary. And a lot of residents there are very concerned about their future. We feel we are not a throwaway society. We need to be respected and taken care of. Kavod, where we live, means honor and respect. And we would like to see some respect coming from Washington.
So what would that look like to you? What does that mean?
Well, in my opinion, Obamacare did a fairly good job of getting it started. And many citizens feel that it could have been adjustments made within Obamacare to make it more palatable to the different politicians without getting rid of it.
So what do you think is missing from the debate in Washington right now?
You know, I think that people forget that whether you want to or not, you are likely going to be sick at some point in your life, even if it's just before death. And thankfully, our hospitals will still treat you, whether you have insurance or not. But in so many cases, if we can diagnose an illness early and get it under control early, we can expand the quality and quantity of your life and conserve cost overall. And so what you'll see is that we're not going to save money by not providing insurance to people. We'll be spending more money on end of life and on fatal complications or life-changing complications that could have been prevented.
So the vote that could come up this week, repeal only, does that cause you panic right now?
You know, part of what people don't realize is one of the provisions in the Affordable Care Act, of course it has many provisions, has added a tax to people whose joint income is over $250,000 of 0.9% for funding of Medicare. We frequently hear that Medicare is underfunded, and people don't realize that Medicare is available to all of us, no matter what income we earn. And so the Affordable Care Act asked those who had high incomes, over $250,000 a year, to contribute a little extra to Medicare. And so when we talk about let's stabilize Medicare, let's make sure there's enough money for it, the Affordable Care Act is trying to do that. So by repealing this, that extra funding for Medicare will also go away.
What do you think, the three of you, Coloradans can do to protect themselves here and now? I mean, when we talk to lawmakers, they always say, call your senators, call your congresspeople. Well, we can all do that, but is there something, I mean, some fix, some unknown out there that we could be doing right now to protect ourselves?
I think you have to make your voices heard, and learning how to do that and get your message across to those in Washington is a difficult thing, time-consuming, but if we don't do it, no one else will do it. We must protect the vulnerable Americans.
I think we need to also be sure that we don't turn this into a Democrat and Republican issue. I think your point was valid. Healthcare is important to all of us for our lives. And if they're not satisfied with this mechanism, let's sit down and talk about what tweaks we could make that would make it work for both sides. Because I think at the end of the day, you'll find that most Americans do care about other Americans, and we certainly do in Colorado. We don't want to see people left out without any health coverage at all.
Do you think that's possible to get both sides to the table to have this discussion?
I think if we treat them like kindergartners, maybe, we might be able to get them together. But at this point, I think they need to look into themselves and understand that they wouldn't want to see their mother go through what we go through. It's hard enough to live a life as a senior without having the threat of your health care being taken away, or the cost so exorbitant that we can't afford it.
I think the time they get to spend at home with their constituents is really important, and I would hope they would take the time to really listen to everyday stories from people. In Colorado, at the state legislature, we have found ways to reach across the aisle and find win-win where we're both giving something up, but we're both gaining something. So I definitely think it's possible. I think that the American people are ready for Washington to change its face and to become a team and not a combat sport. And I do think that they could rise to this occasion and, frankly, make it much better, and then call it Trump Care if they want. We don't care whose name is on it, just so that the American people are taken care of.
And Pat, we'll let you have the last word.
As seniors, we cannot afford additional cost. We are on such limited incomes anyway. So we become a burden not only to our families, which most of us are subsidized by our families also, or we're going to become the street people. So most of you are too young to remember the Depression days, but we had hobos and we had people that were really hungry. And I don't think that us appearing on the front porch of Mar-a-Lago or someplace like that would make a very pretty sight in our beggar clothes.
Well, thank you, all three of you, for being here to share your thoughts with us. We certainly appreciate it. Thank you so much. We'll be right back.